Sandra, how many times do you brush your teeth every day?
I'm guilty. I am so guilty. No, look, I know. But did you know that brushing your teeth too hard can cause teeth sensitivity? Stay with us. We'll jump into the details shortly. Hello, welcome back. My name is Matthew, and this is my YouTube channel. I would like to thank you for your support, and to my returning subscribers, you're welcome. Today we'll be talking about how to keep the teeth clean and healthy. And we have with us a practitioner, a dental practitioner, to tell us all that we need to know. We have here with us Dr. Obi, and he's a dentist by profession. We are going to allow Dr. Obi to tell us about himself
Right.
and what he does.
Thank you for inviting me, Sandra. My name is Dr. Gwemda Nablele. I'm a dentist by profession, and I practice dentistry for a couple of years now. I graduated from a university in my home country called Nigeria in the year 1995. I was opportuned to come over to the UK to do some update courses in dentistry at the time.
What are the most common problems or common dental issues that most patients come to your clinic with?
The key problems that we find is something called tooth decay. Some of us who know that call it, some of us who say, dental caries. It's a common terminology. But when we take a lot of refined foods and sugars and the things like that, the bacteria in the mouth breaks down those sugars. It forms acids, which gradually wear and erode the surface of the teeth, and they therefore causing, in majority of children and even younger adults of today, them having what we call tooth decay or dental caries. In the older generation, what you tend to see is something called gum problems, which you call periodontal problems. Those are the supporting tissues of the teeth, whereby they become weak, they're affected by bacteria, but they begin to get loose and eventually they tend to want to fall out of the mouth. So those are the two major problems that we address. There are so many other aspects of it.
Can you please tell us what are some of the things people can do to prevent these issues, that's the dental issues?
Yeah, very, very simple things, to be honest with you. One of it is the key element, the starting point is getting or having an effective oral hygiene. First, brush your teeth with, your normal toothbrush. I usually advise it's not the force with which you brush that makes your teeth clean, but the technique with which you do it. I usually recommend the soft or the medium one, not really the hard one, because the harder you brush, the more you wear the surface of the teeth, and that could cause sensitivity. So just brush your teeth twice a day. The more important one for me is brushing last thing before you go to bed at night. During the course of the day, when you eat, when you talk, we usually salivate, and that helps. It contains some, antibodies and things which help to rinse out the mouth and rinse out all the food particles and stuff like that. So at night, when you go to bed at night, after eating without brushing, what happens is most of the food you've eaten, probably you still have particles left over in the mouth, which the bacteria is happy to act upon because you're sleeping, you're not talking, there's no saliva produced in the mouth at that time. So the salivation is at its lowest level. The natural protection you have from your mouth is not there. And then the bacteria has a field day working on those leftover food particles, creating acids that erode the teeth. So it's very important that we brush our teeth at least twice a day. So when we're brushing our teeth at night, obviously it's mandatory we use at least a toothpaste that contains fluoride that helps to protect the teeth as well.
We've read on internet, we've seen on social media that flossing and brushing, are there any difference between these two? Because some people will prefer flossing to brushing before going to bed.
Brushing is more important than flossing. Flossing is a support to brushing. Because when you brush, sometimes the bristles of your toothbrush cannot get between the spaces of the teeth, and that's where flossing comes into play. So flossing helps to clean those spaces between the teeth where your toothbrush cannot get to. Also, in addition to flossing and brushing, there's something else we can use. We're talking about mouthwashes and things like that. What the mouthwash does is the mouthwash tends to help. One, some of them do contain fluoride, so they help to strengthen the teeth. Two, what they also do is that they help to they have what we say, they contain solutions that help to minimize the effect of bacterial damage to your gums. So in other words, it's like a form of chemical control.
In your opinion, or coming from a dental view, what diet suggestions would you recommend for our viewers?
For diet suggestions, the most important thing is one, reduce the amount of refined foods you take, particularly sugars. And then the other key thing, and avoid regular in between snacking, because that also, contributes to the amount of sugar in the mouth, which the bacteria breaks down and then causes, some form of decay.
Okay, so we've got two questions, and I think these two questions are almost the same. Somebody's asking, is teeth whitening useful or is teeth whitening good? And then the other question is, are there treatments for discolored teeth?
Tooth whitening, teeth whitening, like I said, is good if done properly and used effectively. For some people, it helps improve their confidence, their smile, and it just generally gives them this feeling of brightness, of goodness, of this. There's this, would I say, this atmosphere of good feeling all around. So that's obviously, so that's fine. That's why I said it's good. Tooth whitening is not for everybody. And above all, there are certain people, you want your teeth to be white, but there are certain things you do which obviously causes discoloration of the teeth. I mean, it's always appropriate and ideal to have your tooth whitening done with somebody who is adequately trained to carry out this procedure. And usually for us in the United Kingdom, it is the dentist. Regarding tooth discoloration, yes, we do have treatments for that. Now, discoloration could be categorized into two areas. One, there's something called intrinsic discoloration, and two, there's something called extrinsic discoloration. Intrinsic discoloration means discoloration from the inside. That's a natural occurrence. That's something you had no control over. Whereas extrinsic discoloration is something from the outside.
So, what is your approach in helping anxious and nervous patients who come to the clinic?
We see a lot of nervous patients. Sometimes I tell some of my patients that the dentistry is a necessary evil. But you see, dentistry has never been in the place where it is today because so many things have been put in place to make patients as comfortable as possible. But nonetheless, obviously, I mean, you can't help it. There are some people who have a phobia for the dentist. There are some people who, are very, very nervous.
Yes.
And so there's always room for what we call sedation. For any form of sedation, obviously there are certain guidelines you need to follow and certain experts are involved in it. All right.
Okay, Doc, before we wrap up, I would like to ask you, in our daily lives, we are told to do monthly checkup or yearly checkup. Some take 6 months, depending on the time frame that is available for them. Would you also say that we need to regularly check on our teeth?
Yes, we do. The essence of a dental check is basically to make sure that everything is working fine, everything is smooth. If any problem is developing, we're able to see it early and address it early and to make you comfortable. However, there are three categories of people. There are those who are considered as low risk, and they could have checkups between 12 months, or 18 months, or 24 months. Because they are low risk, that means they're doing the things that they're supposed to do, and based on their checkups, they're not having any problems. There are those who fall into the category of what we call medium risk. They're prone to having problems, but at the same time, they might not have any problems. So their checkups might be shorter, and those checkups might be every 6 months. And then there are those who I would consider as high risk. And patients who are of high risk are those ones that we usually will want to advise that they see their dentist every 3 months. People that we consider a high risk are those ones who have a lot of dental decay in their mouth, those who have gum problems, who are more likely to lose their teeth and all that. So we're just trying to encourage them, motivate them to ensure that these problems do not progress any further. But you cannot go to the dentist every day for the dentist to clean your teeth for you. If you do that, I guess I'll become a millionaire overnight. But what I'm trying to say here is that do the basic things right. Do as much as you can, and then see your dentist on a regular basis, if be it 6 months, depending on what category you fall into, and then obviously you can have your teeth for life. The onus lies on you to do the right thing. Prevention is the best approach to keeping your teeth for life.
We are so grateful you were able to come share this thoughts. To you, please don't forget to subscribe and click the notification button so you can get an update of every other video I upload. Thank you for watching.